Hi, I'm Dr. Patty Ford, and I'm just going to quickly talk about the trust in our medical community right now is definitely, and maybe there's been lack of trust before. I've been in the medical field since about the year 2000 in the health and wellness field. I've worked with people in so many different capacities when it comes to their health and wellness care. I would say right now, and maybe it's because we have information overload, we all have little computers we're walking around with, we have access to the World Wide Web. There's so many different ways you can get information right now. It makes food noise, not the food noise you have in your head, but food information is on overload. And I get probably 80 to 100 referrals a month. And one of the common requests is I want to talk to someone that knows what they're talking about. I don't want to Google it. I don't want to look on the World Wide Web because I'm being sold something. So they want to partner with a professional that's just going to step into their food story world and try to help them choose food or come up with recipes or timing or just little changes along the way to help them manage their blood sugar or help them lose weight or help them their gut health feel better. And so a dietitian can help with the medical management of that. But the patient needs to be able to trust that they are using science and they're using what's proven to date to fuel the interventions to help their medical care. If you don't believe in science, then using Western medicine or science-based interventions might be really difficult. And so that's when you would want to use something that's not based upon science, but maybe based upon, I don't know, you have to choose something else. But what's happened in the last, I want to say 5 to 10 years is people have lost trust in the medical community because of what has happened to them, or their belief system has changed, or they have the ability to be really loud about their story, which is emotional, and the emotions confuse logic. And we are emotional creatures. Talk to any psychologist that's good, and they'll tell you we make most of our decisions based upon emotion and not logic. And that's similar with science. Sometimes we go with the thing that makes us feel the best. If you watch the movie The Bucket List, these two men are faced with fatal diagnoses and prognosis, meaning they're given a length of time when their life is going to end. And the movie is about they don't want to listen to the medical recommendations. So despite the medical recommendations, they're going to live life a different way and complete things. They felt the need to complete something, and they went against logic and they followed their emotional choice. And the movie is just a beautiful script on humanity and feeling and love and freedom. Even though there is science involved, they don't follow the science. So you want to really understand your belief system and your value system, and then that can maybe dictate your humanity and your health. I'm a big believer that everyone has their own food story and not one is the same. And so you want to use science, but how you implement that and how you put that into action is different for everybody. And it's going to look different. And you want to make sure you still have pleasure and you still have enjoyment with your food, but you're also still putting the action in and being able to say no and yes to things when that feels right for you. If this is helpful or you like this conversation, hit like and subscribe and follow along.